Good evening. Today I'm going to be showing us how you can register on the Alberta Health Services International Nurse Recruitment Initiative Program. So again, for those in Nigeria, you might need to turn on your VPS because it kind of looks like the site doesn't open from our own ISP. So again, when you go to the website, I'm going to put the link in the description below. There's a simple form. You just have to read and fill in as it applies to you. So again, are you currently employed or have you been previously employed by AHS? I've never been employed. What best describes your status to legally work in Canada? So there's only going to be a drop down, and you can pick from the drop down. So I'm going to select I require work permit. Where do you currently live? I'm going to select out of Canada. My profession is going to be registered nurse. Name, Peter, last name, Obi. And then you're going to scroll down and put in your email. And then you want to confirm the email. Again, confirm this is your email. I'm going to click confirm. What is your current employment position? I'm going to click registered nurse. And then you click continue. And once you click continue, it's going to open up to this page. What is the best number to reach you at? So I'm going to put my phone number, country of citizenship is a drop down. Also, you need to pick Nigeria. Your current country of residence is also Nigeria. Have you successfully completed a Bachelor of Nursing Science? Yes, I have. So I'm going to click yes. Do you have an active license to practice as a registered nurse? I do. I'm actively practicing in Nigeria. Where are you currently registered? Nigeria. Do you have a current clinical experience within the last 12 months as a registered nurse? Yes, I've been practicing. Have you written and passed the NCLEX? Yes, I've written and passed the NCLEX. Where did I write it? I wrote it in South Africa. So again, you need to put this according to what applies to you. So it's asking which year did you write and pass it? So you can put in the date there. Have you applied to the National Nursing Assessment Service? Yes, I have. And then you need to put in your ID number. If you say you haven't, then you won't need to, it won't require all of those information like the ID number and what email you use to access your NAS account and all of that. Again, because I have, it's asking what the result is. Again, for Nigeria, most of our training is always going to be non-comparable with the NNAS. I'm not sure why, but again, that's what you're going to select. Please provide further details on your NAS application or the outcome. So if you have a NAS document, you can go to the summary statement, just copy the summary statement and then impute it here. It also asks, have you applied to the World Education Service to verify your credentials and compare them to Canadian standards? I have, so I'm going to click yes. Again, I feel if you have the NAS, you don't need to go further and do the WES. And if you haven't done any of this, I'll suggest you go for the WES first. Because again, you can also use this with the express entry. So it's asking when did you apply to WES, indicate the date and status of your application. So again, it's completed. So I'm going to put completed there. Have you applied to the nursing college in Alberta? So again, for those who have written the NCLEX, maybe for US or whatever, you can also port to the Alberta Nurses College. So it makes it a whole lot easier with your applications in Canada. So again, whatever you want to apply with, you can move your NCLEX. So I'm going to click yes. I've applied to the College of Registered Nurses of Alberta. When did you apply? So I'm going to indicate the licensing college, which is the CRNA. Again, the status of my application. So for now, I'm in Nigeria. I've had this license for a long time, so it's in dormancy. So I'm not actively practicing in Canada. So I'm going to put that information there if it's required, since it's required. You currently have an open file with another nursing provincial licensing college in Canada. I'm going to click no. Do you have a basic life support certification? So again, it's very important you get this BLS certification because it counts and helps with the application process. We run basic life support trainings in Nigeria. So again, you can reach out or contact me for your BLS certification. Okay, so again, they're asking which of the following units departments are you currently working in providing bedside patient care. So please, if you work offshore, you work in an out of hospital setting, it counts against you. So again, I don't know what happens here, but again, you need this bedside patient care experience. So again, I've been working in emergency. I'm going to take emergency. They're asking how many years experience do I have in this unit. So I'm going to select more than 5 years of experience. Again, prior to this, where again have I worked? Okay, so again, it depends on where you have worked. So you can pick ICU or psychiatric, obstetrics. So I'm going to pick ICU. Then again, they're asking how many years of experience have I had in this unit. So I can just say 3 to 5. And now they're asking which emergency care areas have I worked in the last 3 years. So again, I've worked with triage, I've worked with medevac transport, observation room, major trauma, and all of that. So you can pick what applies to you. And because I initially selected ICU, they're asking me where I've worked in the ICU within the last 3 years. So again, you can pick whichever applies to you. So, and then you need to move down to all of this. So again, which of these equipments or do you have competence or experience in the use of all of this? Yes, I've worked with a mechanical ventilator, advanced cardiac monitoring, hemodynamic monitoring, cardiac arrest management, inotropes, massive transfusions, managing acute stroke patients, care of the trauma patient, and even triage. So again, you're going to scroll down and they're asking which patient group have you worked with? Well, I've always worked with adults, not children or neonates. And then you come down to personal information. So it's going to pick your name from the initial input you made. So there's P2B here. Again, you want to put in your street address, your state. It's going to pick your phone number, your email, and all of that. If you have other work experience, you want to click add work experience and input that also. Then okay, so I've put in one of these. So I work in P2B hospital. My position is RN. So this is my current job. I think it could require the start date. So again, I'm just showing you what you need to do. So emergency unit is a full-time job. So I'm sure this will be required. So let me just pick something here. So let me go back as far as I've been working there since 2012. Okay, because it's my current job. So, okay, I'm going to leave that and then scroll down. If you have other work experience, you want to add that. When you're done with that, add your education information. So currently I'm at Unipod doing my PhD program. It's requesting for graduation completion date and all of that. If you have other educational, just go to your CV and pick up all of your educational information. Again, other than the BLS, which other certifications you have? Okay, the ACLS, the pediatric advanced life support, ITLS. So again, you want to impute all of that here. Those international certifications, don't start writing your MCPDP because it won't be recognized outside of here. Okay, so again, for everyone you want to add, you click the add certification information. If you have any additional information you want them to know, maybe I'm registered with the British Columbia Board of Nursing and all of that, you want to impute it here. How did you find about this opportunity? The AHS website, and then you accept to share your information as necessary. You click for it to add today's date and you click submit. And that's how you complete the AHS application on their website. Thank you very much. And if you have any questions, you can drop them in the comment section. I will try to attend to them. Thank you.